Hi, I see that you had genetic testing done that you wanted to talk to about today. Genetic testing can be helpful in situations where genetics is the only causes of disease. But what you're showing me is that your genetic testing is saying that you are have a higher predisposition and likelihood to get diabetes. And what I wanted to explain to you today is that, yes, genetics do play a role in developing diabetes, but most importantly, some lifestyle things and how you live also play possibly a greater role in developing diabetes. So when you look at your lifestyle, how much exercise you get, how much healthy food you eat versus you said you don't eat many sugary foods, but what is your diet like? Does it consist of all the food groups? Do you eat healthy? And then, like I said, your lifestyle, do you exercise? So now that you know that you have a genetic predisposition to developing diabetes, I think the most important thing to look at now are things that you can modify to prevent yourself from getting diabetes, which would be increasing your exercise, losing weight to an appropriate weight at an appropriate rate, and then also just eating healthier food. Genetic testing isn't always useful in situations like this because there's so many other reasons that can help you get diabetes. So I wouldn't solely look at that genetic testing and say, oh, I'm going to get diabetes, because that's not always the case. Yes, you're likely to get it more than someone that doesn't have a family history or it's not in their genes. But now is the time, knowing that you're increased risk due to genetics and family history, now is the time to make lifestyle changes, like I mentioned, to prevent yourself from getting diabetes. And it's useful information to know that so that you can do what you need to do to look out for yourself and change your life. So I think it's great that you had the genetic testing, but like I said, it's just useful mostly in situations where there's no modifiable risk factors, and the lifestyle changes and eating healthy, and that's all modifiable. You can change that. You can decrease your risk. You can't change your family history or genetics, but you can definitely change what you can with how you live your life and then help yourself. And now's a good time to start with that information.